Councilmember Roach, this is a committee vote on the repeal of public testimony. Yeah. Could you unmute Councilmember Roach?
Thank you. I want to be able to vote.
Ma'am, you can't vote in the committee, so.
Oh, that's right. That's right. I'm sorry.
So I want to go first to Mayor Woods.
I'm here this morning, obviously, to talk about proposed ordinance number 2020-136. I just want to make a couple points. One, I do want to express my deep disappointment and surprise in the way that this has moved forward, given our 50 years of partnership. This came through without a conversation with anyone here at the City of Tacoma. It is the Tacoma Pierce County Health Department. And I'm going to really ask you to pull back this ordinance and let's have a conversation. There are a couple things I'd like to add. Number one, this is not the right time. All the energy that's being used around this particular ordinance should be being used to fight COVID, not to fight this proposal. The other thing I would say is that I hope that you all will remove this. The best way to discover what's best for the community is to talk to everyone involved.
I'm going to go next to Councilmember Bush from the City Council, who's also the chair of the Board of Health.
As a District 4 City Council member and chair of the Tacoma Pierce County Board of Health, I hope you know how deeply concerned I am that this proposal to dissolve the Tacoma Pierce County Health Department and replace it with a health department just under Pierce County organization was brought forward without any consultation with me as board chair, any of my colleagues, or to the best of my knowledge with anyone in the cities or towns of Pierce County. But this proposal would dismantle the independence of our healthcare authority, which does allow it sort of nimbleness that it has right now to respond like it is in the middle of our global pandemic. Changing it right now, I think, is not just drastic, I think it's irresponsible. It doesn't contain a fiscal note, which is actually required by Pierce County Code Section 1.28.075. We deserve to have an objective health care authority that prioritizes sound scientific reasoning in all of our decision making, not just here in the pandemic, but otherwise, and not just a county department that's beholden to the political whims of whoever's in that office at any given time, because that does and will change. I've sat on the board with many of you for a number of years now. I'm asking this committee to not advance this proposal forth for action to the full council, and rather to let us survive this pandemic as a full community and then take it up for discussion and do it well if it's worth doing.
Some of the biggest challenges our country and county face today are COVID-19, racial injustice, the economy, and climate change. All of them disproportionately target Indigenous, Black communities, and communities of color. We have been isolated by all of these challenges, and we are dying. So why, all of a sudden, is the county council focused on severing this relationship with the city and the Tacoma Pierce County Health Department? And why does it feel so sneaky? Pam Roach sponsored the bill, yet when they met to discuss it, she asked to sign on. So who wrote it? We just finished with our Public Review Committee discussions on racial injustices and criminal justice reform. There's a budget to consider. We're asking for positions to be filled for data analysts. Let's get back to business. Stop the political power plays.
I am calling today representing 2,522 people that signed a petition that we have been circulating in our Pierce County community. Our petition's purpose is to save the Tacoma Pierce County Health Department and to demand the removal of ordinance. This proposal has not gone through the public channels as defined by our county before being proposed, has not been to the Human Services Committee or public review. It seeks to dismantle the Tacoma Pierce County Health Department during a global pandemic. It calls for the creation of a new department unnecessarily and wastefully using taxpayer money on hiring and training staff, updating letterhead, and furnishing a new organization. And it enacts layoffs on Tacoma Pierce County Health Department employees who have provided Pierce County residents with excellent services and guidance. All of us, all 2,522 people who signed this petition, called to have this harmful ordinance pulled off of the agenda today and not passed out of this committee.
Christy Gledhill, South Sound Anti-Racist Project. I want laser-like focus on preventing more deaths and distributing the coming vaccine as quickly, efficiently, and equitably as possible. You have gravely misjudged many things here. You thought we weren't paying attention. You thought we were too exhausted at the end of this exhausting year to care. You thought we we were distracted with the holidays. You thought we couldn't muster the effort in the 1 week you wanted to take to shove this through. All of those assumptions are wrong. Drop it now. Do not think that you can put the health of 904,000 people who live in this county in the hands of 8 politicians, none of them health professionals, and all of them white. We have had enough on a national level with COVID confusion and politicization. Do not bring it home to us here in Pierce County. Shame on you and Council Members Roach and McCune and County Executive Dan Meyer for thinking this would be okay with any of us. Shame on you for putting politics over people. We see what you are doing. Vice Chair Morell, you have the most at stake here. Pay attention to what your constituents are saying.
My name is Abby Zulak, and I'm a staff representative for AFSCME Council 2. I represent about 125 union members who work for the Tacoma Pierce County Health Department. This kind of legislation is not how we thank these dedicated public servants for their service throughout this historic pandemic. The instability a decision like this would create for these workers in the middle of a pandemic is demoralizing and disrespectful. I also represent hundreds of AFSCME members who work for Pierce County. I've helped many of those employees navigate safety in this pandemic so that they can continue to come to work and serve your constituents. When I hear from Pierce County employees about a potential exposure, I immediately call the Tacoma Pierce County Health Department. I have always gotten a real person who can quickly answer my questions on the phone within 10 or 15 minutes. Pierce County staff are safer because of the AFSCME Local 120 workers at the Tacoma Pierce County Health Department. An attempt to defund this agency by removing Tacoma's contributions to this service is a disgraceful move that will harm not only your constituents, but the workers who serve those constituents.
I am a public health professional, having built a career in public health preparedness, which is a specific part of public health that prepares our communities for emergencies. I have been doing this work for nearly 20 years and currently work in COVID response for Public Health Seattle and King County. Right now, we have 2 more weeks of guaranteed COVID funding because the CARES Act hasn't been nationally renewed. After January 1st, we lose a huge portion of our team suddenly and without the ability to replace them. Every week, I sit in briefings where I hear the entire state, not just Pierce County, slip further and further from the metrics indicating success in a pandemic. Before the pandemic, all health departments statewide were at skeleton staffing unless grants were sought. Losing the proposed $1.1 million in revenue in the middle of a crisis is incomprehensible to me. Our target case rate right now is 25 cases per 100,000. This week, our case rate is nearing 400 per 100,000 in Pierce County, and all of our neighboring counties are with us.
My name is Stephen Cook. I'm a family physician. I've been working here for 17 years, 7 in Lakewood and now 10 in Tacoma. I was also a member of the Board of Health for 4 years, serving as the medical representative for the Pierce County Medical Society. While there, I worked with a number of the county council that are currently members. I never felt that our work was terribly partisan. I always felt like we had a good cooperative relationships. I always felt the medical community was underrepresented, not overrepresented on the board. This would eliminate those single medical representative on the board overseeing the Department of Health. So it does not seem to actually serve the purpose stated. I learned about this proposal when I was in the doctor's room at St. Joseph's Hospital. I was there rounding on patients, including COVID positive patients. Not a single other doctor in the lounge could understand why in the world this proposition was put forward at this time and what benefit it would serve to the community.
Hi, this is Therese Pasquire. I'm the CEO for Sound Family Medicine here in District 2. I live and work here in District 2, and on behalf of the entire professional staff at Sound Family Medicine, we have over 50 healthcare providers that care for our population here in Pierce County, and they didn't have time to come to this meeting today because they're seeing patients. But what we'd like to say is that the current combined department has been an excellent resource for healthcare professionals in good times and healthy times. But with the stress of COVID in our community now, we need more resources devoted to public health. And a weak health department would really jeopardize our value-based work that we've been doing here throughout this pandemic.
Hello, this is Dr. Jeff Smith, and I'm the Chief Medical Officer at Community Health Care, the largest community health system in Pierce County. I'm also calling as the past president of the Pierce County Medical Society and actually give the regrets of Dr. Alex Mohis, who is the current president but is unable to attend this meeting this morning. And it seems not to be backed by facts. We try to do evidence-based medicine, and I have not seen any evidence which would show this would be an improvement. And as a matter of fact, lots of warnings that this could be very dangerous. We have a well-established vaccine distribution system with the Tacoma Pierce County Health Department, which would have to be restarted and somehow done in the midst of the most important time to get vaccines out. So I would also urge you to put this aside.
Hey, my name is Dr. Rebecca Taxier. I'm a pediatrician at Pediatrics Northwest and a resident of District 5. At Pediatrics Northwest, we're a group of over 20 pediatricians, and we care for over 45,000 children in our community here in Pierce County. I speak for myself, but know that the other physicians in my group feel similarly, and we are disappointed in the ramifications of this proposal and what it means for children and their families in our community. I agree with the Washington State Medical Association and the Washington chapter of the American Academy of Pediatrics that now is not the time to revamp the county health department. We would like you to meet with us and better understand why we as physicians urge you to vote no on this proposal.
My name is Joseph Barlow Farrar. I'm a precinct committee officer, Legislative District 29, precinct number 601. Right now, an American dies every 30 seconds from COVID-19 alone, and it's speeding up every single day. This move has ramifications for everything from drinking water to drug treatment to maternal health.
Hi, this is Michelle Douglas, and I'm the CEO at Emergency Food Network. We have seen so many different issues that have required extensive study, like the 1% for mental health. And the county has always required just a really thorough vetting process, a fiscal examination, all of that. I've been writing to council for days asking for input of why this seems like a good idea.
For a council that has spent decades researching a simple behavioral health tax, it's unconscionable to contemplate a change of this magnitude with little to no research of the implications. Please don't dismantle the only agency that's provided a modicum of leadership during this COVID crisis. Do your jobs. Vote no on ordinance 2020-136.
I am an economist, and this is a fiscally irresponsible proposal.
We as constituents voted you into the council to be our voice. So I would like to name names. We've got Dave Morrell, Pam Roach, Jim McCune, Connie Ladenburg, Marty Campbell, Doug Richardson, Derek Young, and let's not forget Bruce Stanmeyer.
The Tacoma Pierce County Health Department is doing an excellent job. It's literally a national model for running a local health district, and we ought to keep it, not take it apart.
And they're also in charge of checking out whether or not the ground is polluted when developers come in and do stuff. And speaking of developers, that's where you chase down the money on this one.
I urge you to vote no on this measure to make the health department into a county department. This is a destructive and partisan act of power politics done in the last days of the Republican majority. This is not in the best interest of the people in the county. It is the county's responsibility to provide advice and funding to the health department through a bipartisan board. As a county, we need to work together on all our decisions so that everyone has a say and no one party, no interest group gets their way. We need to consider the words of Abraham Lincoln. You must govern with malice towards none and charity for all.
Just because we can do something doesn't mean we should, or that it's in the best interest of Pierce County residents.
All those words that are being proposed to be stricken from the RCW were put there by experts, by politicians, just like yourselves. And I assume they did it for at least pretty good reasons. And to see that amount of text stricken without any real text to replace it just strikes me almost as a political malpractice.
But this proposal made by outgoing district council member from District 2, Pam Roach, to terminate the Tacoma Pierce County Health Department after 50 years in the middle of the worst pandemic of our lives is not only ludicrous, but puts public safety in a very precariously dangerous position. She does so with no comprehensive replacement. If the other Pierce County Council members that are leaving office vote in favor of this unconscionable position, it will follow them in their public careers and forever cast a legacy in shadow. It's essential that the health department be run by a separate, independent board of directors with no political or monetary gain connected to their role. We have seen recently across the nation and in our state how politicians have tried to undermine a scientific approach to the current pandemic for their own political purposes.
We haven't heard one comment today in support of this ordinance. Dave Morrell and all council members, we need you to hear and respect the voice of the people.
Please consider voting this down today in committee so that everyone involved, the entire public health community, can go back to trying to save lives.
I will say that, the reason I asked to not limit the public comments is because there's very little time for folks to speak up on this, and it only adds to the perception that there's something improper going on here. The speed that this is going, the fact that it's not going to the Human Services Committee, the fact that we're going to be voting on this final decision to terminate a partnership that is older than I am, that is adding fuel to that fire. It would behoove us to slow this down. The irony is that in the wake of this pandemic, I had viewed expanding the partnership as a primary goal once we were through that part of the process, and actually adding more of our city partners. If anything, we've demonstrated the value of public health, and that the cuts that have taken place, particularly at the federal and state level over the last 2 decades, have put us in a weaker position, that we need to strengthen that. And that means asking our city partners, to potentially join us. I've also thought about changing the board composition so that it's not so heavy on elected officials, and adding more medical professionals and public health, people with public health background. It even makes sense to potentially look at having some of the other governmental organizations that we partner with on a regular basis, like our schools, have some representation there. These are all things that we could do, but by undoing that partnership, I think we're heading in the wrong direction. One thing I do want to clear up is that partnerships are the norm in Washington's public health. While we're one of 2 city-county partnerships, the bulk of the rest of our public health districts that are very similar. In fact, in many cases, they're actually multi-county agencies. So this trend to go away from it into a county-run department, you really only see them in fairly small counties by comparison, where there's only a handful of employees that are running that and a human services department. So we would go from a model organization, one that is admired by its peers around the state, and frankly, nationally, to one that is kind of abnormal. And to do that in this haste without doing the comparative analysis between the systems to see what would really be best, I'm not really understanding what's going on. It's valid to research what the best governance model is. To do that during the teeth of a pandemic, when we're about to face some of the darkest months over the next couple months, I think, in several decades in our county's history, and when we need our county health department planning for a rollout of the most complicated immunization program in our history, it just seems like this is a distraction that is not worth whatever potential reward the sponsors see behind this. So I urge a no vote.
We have some non-committee members who wish to address the committee this morning.
I always appreciate public participation. I think it's really important. There's nobody disbanding this health department.
Councilmember Campbell.
I was disappointed that we cut off public comment early, and I understand your request to ask people to send it in writing. I know in our packet today we have over 700 pages of correspondence that we've received on this, and that was prior to this morning. And today in my email, I've received over 100 more comments. They are very overwhelmingly and passionately opposed to this. And I agree with them. And I would really just ask the committee to think about this and set this aside and vote no on this. This has been, I think one caller described this as a debacle. I received correspondence with a member of the EOC this morning who's not part of the health department, who says the morale out there just got devastated within the last week. We don't need our EOC and our health department morale being attacked at this point. They spoke of Executive Dan Meyer's visit last week and said it was a completely mixed signal. of what's going on, and it helped afterwards create even more uncertainty. We don't need our frontline people being distracted by this. This vote for the termination of the Tacoma Pierce County Health Department ILA is irresponsible for us at this time. Just set this aside. Let us focus on what we need to focus on and do the work of the people.
Okay, it's been moved and seconded that all approved amendments be rolled into Proposal 2020-136S and forwarded to the full council with a do pass recommendation. All those in favor, please indicate by saying aye. 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 Opposed?
Nay.
Okay, the ayes have it. Proposal 2020-136S will be forwarded to the full council with do pass recommendation.
This is an embarrassment to the county and to the city. This ordinance needs to be put in the trash can.